Good evening. We start tonight with the unprecedented measures being enforced right across Italy to try to limit the spread of coronavirus. As the number of cases and deaths rises sharply, Italy faces growing isolation with thousands of flights cancelled and stringent controls on its borders with Austria and Slovenia. Public gatherings, including sports events, are banned and schools and universities are closed. Italians are being advised simply to stay at home. The number of confirmed cases has risen to more than 10,000 and the number of deaths in Italy has increased by more than a third to 631. Here in the UK, a sixth person has died and the number of cases here has risen to 382. More on that in a moment. But first, this report from our Italy correspondent, Mark Lowen.
All residents stay at home, orders the police. From Naples in the south to the supermarkets of Rome, to the financial capital up in Milan, news of the restrictions spread as fast as the virus. In Bologna today, they began to adjust to the toughest limitations since the war. Public gatherings banned, bars and restaurants closed from 6 p.m, tables a metre apart, schools, museums and nightclubs shut. Everyone is affected. Italians, tourists and expats living here, staying put as several airlines stop flights.
Well, obviously we won't be able to travel in the immediate future. We've been told that we can only take trains between the cities in Italy for reasons of work or health or for some extraordinary emergency. And apart from that, we must stay put. But that seems sensible.
And another thing is they've put this limelight or spotlight on age groups and makes me feel really, really old. But I'm optimistic about it.
Moving around requires a form, which we also had to complete, allowing travel for work or health emergencies or to return home. We'd have to produce it if asked. It says here that falsifying this document could lead to prosecution. Never could people in Italy have conceived of the idea that they'd need this to be able to move within their own country. As we drove out, traffic seemed quieter. Roads are open, though Slovenia says it will close its border, and Austria has banned Italians entering unless with medical certificates. Well, we've come out of Bologna now and we're on the motorway to Rome, and we haven't seen any police checks for the documents, so it's still not clear how these restrictions are going to be enforced. We pulled over and got through to a doctor in one of the worst virus-hit areas. Hospitals are near breaking point.
We need more beds, more doctors, more nurses, because I think that in 1 to 2 weeks we will reach the top. So if we will not have more facilities, we will not know how to take care of the patients. We are facing a war now here.
In Rome, deserted tourist sites show the huge economic impact. The government now discussing suspending tax and bill payments to ease pressure. From inside the Vatican, the Pope led Mass, urging priests to have the courage to visit the sick, a risky call. And often it's too late. Even funerals are now banned, replaced with a restricted blessing. The virus is killing and taking Italy's dignity with it. Well, this area of Rome, the tourist heart beside St. Peter's Square, is usually buzzing with restaurants. Now look at it. And tonight, the Prime Minister's office says they're considering imposing even more severe restrictions. One last thought, Hugh. In the northern town of Codogno, the original epicentre of the virus, for the first time, they've reported no new cases in the past day. A glimmer of hope, perhaps, so desperately needed here.
Mark, many thanks again. Mark Lowen with the latest there for us on the situation in Italy. He was in Rome. Well, several airlines, including British Airways and Ryanair, have cancelled all their flights to and from Italy for a month, leaving some passengers stranded. Others, including Air France, have announced drastically reduced timetables. Our transport correspondent Tom Burridge is at Heathrow Airport with the latest for us.
Hugh, with airlines cancelling thousands of flights today, some people have contacted us who are out in Italy wondering how they're going to get home. Now, some people, a small number, will be able to book onto Ryanair flights, which will still operate until Friday. And EasyJet is going to operate a small number of what it's calling rescue flights in the coming days, both to bring people back to Britain and for essential travel out to Italy. Now, the government is talking to airlines. I'm told it's a fluid situation. They're trying to work out exactly how many flights are needed so that anyone who lives in Britain, who's out in Italy at the moment, can get home. But airlines are being hit more broadly because passenger numbers globally have fallen off a cliff. And that's why you've seen airlines like Norwegian Air today cutting 15% of flights out of their schedule in the coming weeks and saying they'll temporarily lay off some staff. British Airways has emailed all of its staff asking them whether they're willing to take voluntary unpaid leave. The airline industry is a precarious place at the best of times. These are the worst of times, and airlines are being hit hard.
Tom, many thanks again. Tom Burridge there with the latest for us on the airline industry's problems. He's at Heathrow there. With me here is our medical correspondent, Ferguson Walsh. Fergus, again today, not surprisingly, we're focusing on Italy and the drastic measures there. Are we in a better position now to understand why Italy has been so badly hit?
Some of it, Hugh, is down to poor surveillance early on, around mid-January. For several weeks, this virus was circulating silently, and so cases were being missed, and the Italians have been playing catch-up ever since. A lot of transmission among families in the home between generations, and Italy has the second oldest population in the world after Japan, hence the high death toll.
When we think about the pressures on the Italian health service, which of course is a very advanced service, and then we think of our own NHS, which is clearly also a very advanced service, do you think the NHS would cope in the same way? Would it feel the strain in the same way as the Italians have done?
The simple answer is any healthcare system in the world would feel the strain with this level of pressure, and it's down to sheer numbers in Italy. This is, we keep saying, a mild illness for 4 out of 5 people, but when you've got more than 10,000 cases, you get a massive impact from the minority, and it's been sobering to read reports from doctors about their critical care units being nearly overwhelmed with patients with pneumonia, with organ failure, lack of ventilators, and setting up makeshift intensive care beds in corridors. Now, we simply don't know whether we'll have that level of outbreak here. It could be not as bad as in Lombardy, but we can't leave it to luck. We have to prepare.
Fergus, many thanks once again. Fergus Walsh there, our medical correspondent. Well, here in the United Kingdom, a man in his early 80s has become the 6th person with coronavirus to die in the UK. The patient, who was having underlying health conditions, caught the virus here in the UK, not abroad, and died in Watford General Hospital. More than 26,000 people have now been tested for the virus in the UK. There have been 382 confirmed cases. Part of the government's plan is to try to limit the number of people who need hospital admission, and that means GPs playing a central role. Our health editor, Hugh, has more details.
This is the sort of protective equipment which NHS staff have to wear if they're in contact with patients possibly infected with the coronavirus. Here, 2 nurses demonstrate how it's put on ahead of carrying out a test. GPs are now being sent the equipment for use in their surgeries. One leading GP said they expect many patients to come in, even though those who might have the virus have been urged to stay away and call NHS 111, and that'll mean non-urgent appointments being cancelled.
We do expect cases to rise rapidly over the coming weeks. Practices are routinely doing health checks, assessing people's blood pressure, diabetic control, long-term problems with heart disease and lung disease. Those routine checks will need to stop.
Some GPs have complained they haven't yet received the equipment. Ministers say it's being sent out this week.
We wanted to get the timing of the rollout right so that the equipment is there should this epidemic hit in a very large way.
A 6th patient has died in the UK with the coronavirus. At Watford General Hospital, a man in his early 80s who had underlying health conditions. And at the Specialist Children's Hospital Great Ormond Street, a health worker tested positive for the virus. Non-essential heart surgery and related appointments will be stopped for 2 weeks. The son of a patient who died at the North Manchester General Hospital, now in isolation himself, spoke to the BBC.
My father obviously has passed away, and I cannot even go to the hospital. His illness 2 months ago or so, it didn't even exist, and yesterday just took away my dad, and it's really, really heartbreaking.
So with the spread of the coronavirus, what is the NHS facing up to here, whether it's GP practices or hospitals? One senior health official said today there could at some stage be thousands of cases in the UK.
We can expect, if you like, a peak in cases. It has a relatively slow take-off at the start, and that's really where we are at the moment. It will start to rise quite sharply.
Hello Jonathan, it's Dr. Mayer here.
GP video consultations will be more common, with infected patients at home and others who want to avoid surgery visits. This is a demonstration with a member of staff. The NHS care we're all used to is set to change radically for a time as the virus epidemic reaches its peak. Huw, BBC News.
Well, let's take a look at some of the day's other coronavirus developments. China's President Xi Jinping has visited the city of Wuhan, the origin of the coronavirus outbreak. His visit is being seen as a sign that the authorities believe they have the situation there under control. China has recorded its lowest number of infections, just 19 during Tuesday. All were in Wuhan, apart from 2 people who had arrived from overseas. In California, after 5 days stuck on a cruise line off the coast of the state, more than 120 British passengers on the Grand Princess are this evening waiting to board a plane home. They'll have to be screened for coronavirus, but if they're free of infection, they should arrive in the UK tomorrow afternoon and begin 2 weeks of self-isolation. As we know, it's not just Italy that's been badly affected. Let's have a look at some of the other countries in Europe. In Spain, for example, where 1,646 people are confirmed to have coronavirus, the lower house of parliament has been closed for a week after a member tested positive for the virus. Almost 1,500 people now have the coronavirus in Germany. The first ever Bundesliga football match to be played behind closed doors will take place tomorrow night. And in France, the second worst affected country in Europe after Italy, there have been nearly 400 new cases in the past 24 hours, bringing it to a total of 1,784 cases and so far 33 deaths. So let's join our correspondent Lucy Williamson, who's in Paris tonight. And Lucy, just update us on the situation there and what ministers in the French government are saying.
Well, President Macron has said he thinks what he called disproportionate measures would be counterproductive at this stage. But there are at least 5 MPs among those who have been tested positive, including 1 government minister. And already in the worst affected areas of the country, schools have closed, all gatherings of more than 50 people have been banned. So there's no markets, people are cancelling their weddings. And across the country as a whole, the restrictions are being tightened. So there's now a nationwide ban on any gathering of more than 1,000 people. And that means that sporting events are being cancelled, concerts are being cancelled. One problem France does have is that it's got the first round of its local elections coming up this weekend. So special measures are having to be put in place to stop the virus spreading at polling stations. And they include asking voters to bring their own pens.
Lucy, thanks again for the update there in Paris. Lucy Williamson, our correspondent. Well, in another sign of the economic impact of coronavirus, some tourism operators in the UK say that they're seeing significant cancellations. Our correspondent Danny Savage has been talking to business owners in the Yorkshire Dales and in the Lake District.
It's only March, but the effect of coronavirus is already being felt on tourism in the Lake District. For the main ferry company on Windermere, they're already dealing with foreign visitors not coming.
It's having a huge impact on the business.
But now people living within driving distance are staying away.
What we're seeing now is the reluctance of UK visitors to move around the UK, and we're hearing reports from hotels and self-catering accommodations that they're not receiving the level of bookings that they would imagine to at this time of year.
These boats are tied up because it's low season, but there's a fear that this could be the scene in months to come, and that would be a real indicator of just how big a hit tourism is taking. Other businesses aren't hiring seasonal staff this year because they don't believe the demand will materialise.
Well, we've already had quite a few cancellations already.
Louise lets a spacious self-catering annex in her home to tourists. Cancellations have consequences, not just for her.
The cleaning lady, the laundry people, the decorators, the gardeners, their income will go down because they don't have any other source of income.
She can't understand why UK visitors are beginning to stay at home at this point.
We popped down to IKEA and John Lewis at the weekend and they were packed, cheek by jowl. And yet folk are thinking, oh, we better not travel to the Lake District or to anywhere else in case there's a health problem. I find it quite bizarre, actually.
So this is the workshop room. This is our biggest letting room.
40 miles away in the heart of the Yorkshire Dales, Neil and Jane run an award-winning bed and breakfast in Bainbridge. In the last few days alone, they've lost 16 nights of future bookings. But because it's a virus, they understand why.
If we get somebody coming here with a cold, if we get a slight sniffle, when do you know? That's what the difficulty is, the uncertainty. Nobody knows at the moment, which I think is why our future bookings are quieter.
I'm very optimistic. Yeah, I think that it will pick up once people understand what's going to happen next. You know, I think there's a lot of uncertainty about what's going to happen.
Back in the lakes, this is what it should look like this spring. But will it? The losses are already stacking up, and they're worried not just about their health, but about their incomes too. Danny Savage, BBC News, Windermere.
Well, measures to help tackle coronavirus are expected to feature prominently in tomorrow's budget. It's the first for the newly appointed Chancellor Rishi Sunak. He's also expected to promise to boost infrastructure spending to its highest in decades, possibly, on rail and roads, affordable housing, broadband and research. Our political editor Laura Kuenssberg is at Westminster. And Laura, what are we expecting then tomorrow?
Well, Hugh, they're very serious, as we were just hearing there in Danny's piece, real-life reasons why the Chancellor, barely a month into the job, is going to be under significant pressure tomorrow to spell out how he will be able to tide businesses through what could be a very, very significant impact of coronavirus. How is he going to help them stump up with sick pay, for example? How is he going to help them with cash flow? How is he going to make sure that the NHS actually does get everything it needs, which he and the Prime Minister have promised? And coronavirus has completely changed the wallpaper, the backdrop, if you like, for this budget, the first since the EU, since we left the EU, and the first since the general election. And just in terms of trying to put the budget together, the numbers have all completely changed in the last couple of weeks with everything that has been happening on the markets. It's been like trying to juggle water with the Treasury. That said, there is no way that the government's going to give up on the promises that they made in the manifesto. They say they want to get on with the promises that they made in terms of infrastructure spending. So tomorrow I understand that they will set out more than £600 billion over 5 years promised for roads, rail, research, those kinds of things. An eye-watering sum of money, not that different when we compare it with what was promised in the manifesto and already planned, but certainly a change of gear compared to recent decades. Remember though, spending on capital, things like bricks and mortar, roads and rail, are not the same as day-to-day spending in government departments. So promising big cheques for the future does not mean that the strain, the very real squeeze on some government departments will suddenly disappear.
Laura, many thanks again. Laura Kuenssberg looking ahead to tomorrow.